Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. It is the 10th anniversary of our Health Matters show and the 45th anniversary of our company. Today, we're featuring a program about hospice and palliative care, one of the programs that we feel is most important to the community we serve. Before we begin, I'd like to thank our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, and of course, our socially distant technical producer, JD DeAngelis. Today, Brad and I are broadcasting from our administrative offices, and so is Dr. McFadden from Community Hospice. Good morning, Dr. McFadden, and welcome to the show.
Good morning. So glad to be here. Thanks for the opportunity.
World Hospice and Palliative Care Day takes place on October 9th with the goal of improving the quality of life for people affected by serious health problems. Those that have life-limiting illnesses have the right to be cared for in the way that best suits their needs, and this holiday emphasizes that. Within our healthcare system, both hospice care and palliative care are relatively new specialties. You might be surprised to learn that hospice care was not recognized by Medicare until 1983. The term palliative care is even newer and less familiar, as the first palliative care center was established at the Cleveland Clinic in 1987. Today, we're going to talk with Dr. McFadden, MD, MPH from Community Hospice about both hospice and palliative care and the mission of Community Hospice to honor life by providing peace, hope, and compassion to those they serve. We'd like to remind our listeners that our program is available on our podcast. Just search for Health Matters with the Medicine Center Pharmacy in your favorite podcast app, and please subscribe to our program.
So it's an exciting time in the pharmacy. We are celebrating our 45th anniversary by giving away $45 gift certificates to several local businesses and tickets to a Cleveland Browns game. No purchase necessary, just stop by and register to win. We are giving away gift certificates to the Daily Grind, Lindsay's Restaurant, Anastasiades Chocolates, Grinders and Above and Beyond, Kishman's IGA. So Dr. McFadden, welcome to the show. We're glad to have you on, and thank you for your service to the community during this pandemic. You and all healthcare workers are appreciated very much. So tell us about yourself and introduce yourself to our listeners.
Yes. So thank you so much again for the opportunity. I'm a family physician, born and bred here in the Midwest, and I have over 20 years of practice. I've worked in private practice, in public health, as well as hospice and palliative care. My father was a pastor. My mother was a hospice nurse, so I'd like to think that I was meant to work in palliative care and hospice.
Interesting. Wow. So what is hospice care, doctor?
So hospice is a specialized type of care for individuals with advanced disease who are at the end of life. Hospice care is focused on quality of life and aggressively treating symptoms that are causing distress for the patients. Unlike other types of medicine that usually start with a disease or start with a cure, hospice starts with the person and the family and tries to understand their goals of care and what the family's goals are. And then the whole team works together to try and address those goals.
So what about palliative care? How is it different from hospice care?
So while hospice care is specifically designed for individuals who are at the end of life, who are terminal, palliative care is a type of care for individuals with serious illness at any stage along their continuum of disease. So they could be early in their disease, but have or they could be late in their disease. The individual doesn't have to be terminal in order to, or have a terminal illness in order to receive palliative care services. Palliative care also focuses on quality of life, also focuses on symptom management. And palliative care works to understand the goals of the patients and the families as well. But unlike hospice, patients receiving palliative care also receive curative therapies at the same time. In a practical sense, the services provided are a little bit different in that hospice, because it's a home-based program, provides nurses and aides and chaplains and social workers that go into the home, as well as paying for medications and providing medical equipment like beds and that sort of thing. Whereas palliative care, because the individuals are not typically homebound, they still go to their doctor's appointments, still receive their prescriptions usually by going to the pharmacy. And so those are some of the practical differences between the two.
So how do we decide which direction the patient would go?
So the first determining piece is that the individual to be in hospice has to be terminally ill. And the definition of that is that two physicians need to agree that the patient only has 6 months of life left. And so that you have to meet that in order to enter hospice. If an individual qualifies for hospice but really doesn't want hospice, palliative care would probably be appropriate for them because they have a serious illness. They just aren't ready for hospice. Palliative care would be appropriate for them. If an individual has a serious illness at any other stage, then those last 6 months, they would be appropriate for palliative care.
You know, in the early days of hospice, and we happened to be have a business that was providing sterile antibiotics, sterile products, that sort of thing at the time. And it was said at that time that by nursing and doctors that it mostly waited too long for them to enter a hospice. Like it was at that time back in the 80s or whatever, I can't remember where that was. They were put into hospice a few days before death. And I believe now that they go into hospice much earlier, or can, like 6 months I saw or something. So what about the palliative care thing then? When do is that the same sort of barometer time, or where are we at here?
Yeah, no, so palliative care, people at times are in palliative care for years. And so to enter into palliative care, it really depends a little bit on if the individual or family, if they're needing a little bit of extra support while they're seeking their curative care. So palliative care, they're really, I would say that the earlier that we get people into palliative care, often the better managed their chronic and serious illnesses are. One of the things that palliative care adds to the curative medicine that patients might be receiving is there's a case management aspect to it. So individuals have a nurse that's assigned to them in palliative care that they can contact if they have questions or concerns, typically. And that gives them an extra bit of information. I think that every family would benefit from having a doctor or a nurse in their family that can answer questions for them. Not everyone has that, and not everyone has somebody who's trained to deal with serious illness, chronic diseases, that can give advice, have access to a doctor immediately that can be responding back to the patient. So for palliative care, I think that the advantage of starting early is that people can reduce their hospitalizations by having access to clinical staff that can address problems earlier. And so I think that for palliative care, yes, earlier is better as well, because I think that would potentially lengthen one's life. We've seen that folks that are involved in palliative care actually live longer. So avoiding unnecessary hospitalizations, getting treatments earlier rather than when anyone in the family could recognize that there's a problem, having a clinician that's available that can help with palliative care patients to identify problems so they get addressed earlier.
Okay, so hospice care is sort of a Medicare constituent or whatever. What do we get? What kind of services does hospice provide? I mean, I think I know about pharmaceuticals and hospitalization, stuff like that, but what's the total picture here?
Yeah. So you're absolutely right in that hospice is a benefit of Medicare, and most other insurances provide a hospice benefit as well. And with hospice, individuals have home care or wherever their living situations, because it might be in an assisted living, it could be at a nursing home, but they receive care, a nurse that comes to visit them at least once a week, typically, sometimes more than once a week. They also have access to aides to help with hygiene care. So for showering, or if there are other needs that the patient might have, There are nurses' aides that come into the home, and they're there typically several times a week. They have access to social workers who can help them with, some of the end of life decisions, getting them hooked up with resources that they might need, but also helping to provide advice regarding, finances and other things, so that they know the right questions to ask, get them set up financial or their legal advice. So the social worker is sort of very important in connecting all those dots and keeping those links open. And then they also have access to chaplains. The end of life is a time for both families and the individual patient where spirituality plays a significant role. And so having chaplains that are there to walk with and help guide that spiritual, sometimes questioning, but also spiritual growth that can happen at the end of life, to walk with folks at that time. But then you're also absolutely right, prescriptions, equipment, as we mentioned before, like, beds or oxygen or nebulizers, all of those are things that folks can expect. And then often individuals can expect other resources in the home, such as massage therapy, limited physical therapy, sometimes musical therapy, in some programs, pet therapy. So there's a lot of different resources that individuals can experience in the home through hospice.
Okay, doctor, we're going to take our first break here. You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. It is our 45th anniversary, and we would like you to invite you to transfer a prescription to the Medicine Center Pharmacy and receive a $25 gift certificate. It's simple. Just call and talk to our pharmacist. So doctor, I happened to visit some time ago a hospice group of people who were, and spoke a little bit to them, and I was really quite amazed at the optimism of these folks in this hospice group. Are these groups still meeting? I can't remember exactly where I was. It was one of the hospitals, but I thought it was kind of amazing.
Yeah, I think, COVID limited some of our ability to meet in person, but yes, absolutely. I think that the getting together and having those times, and I would say that absolutely many folks consider hospice to be, sort of giving up and depressing and all of that. But I would say that working with individuals who are taking charge of their care at the end of life and are saying, this is what I want to die with dignity, with my symptoms managed, that is empowering for patients and their families. And for the folks that are working with people, it is a mission. When I worked in private practice and delivered babies, I would say that, everyone walks towards folks that are pregnant. They ask questions like, when's your baby due? Is it a boy or girl? But at the end of life, when we have a terminal illness, people walk away. And to be part of the team that is intentionally walking towards people that doesn't have, they don't typically have people walking towards them. That can be life-giving to those of us that are walking towards as well. Just because we know that it's definitely needed, and there aren't a lot of people that can do that.
So you mentioned that patients can receive hospice care in their homes. I know that some hospital systems have facilities for hospice care. I assume that's an option also.
Absolutely. Yeah. So we typically talk about hospice, seeing folks wherever they reside. So if they're in an assisted living, hospice goes to assisted living. If they're in a nursing home, hospice goes to the nursing home. If they're in their own home or their family's home, hospice goes there. But there are times when individuals need a little bit more care, or their caregiver can't provide the care. And so throughout the state of Ohio, there are several hospices that have an inpatient unit, a special unit that is just for hospice. For those that don't have an inpatient unit, they might contract with a hospital or with a nursing home to provide that care. And in that setting, when someone has symptoms, for example, that they can't manage at home, like nausea or pain, they can come into that center or to the hospital or the nursing home if that's where the contract is. But they can come into the center and they will have 24-hour nursing on site, as well as physicians who are rounding and are making adjustments regularly, several times a day, to try and get those symptoms under control. So that's one of the benefits of having an inpatient center. The other use for those centers is, say, the primary caregiver at home who's providing the meals and much of the hygiene care and comfort. They themselves have a medical need. They have a fall, break a hip, have a short hospital stay that's needed, or need or want to go visit a grandchild across the country, but the patient hospice is not well enough to go. Then they can come in for a respite, a short stay, typically 4 days, while their caregiver is not available. So those are the benefits of having an inpatient center like that. Absolutely.
Can you touch on, I can only imagine how stressful it is on family members and the patient during a hospice experience. How about insurance coverage and Medicare coverage? Can you touch briefly on that?
Certainly. So hospice is a covered benefit with Medicare. So what that means is that with Medicare and with most insurances most insurances do have a hospice that medications that are used in hospice are covered. The equipment is covered. The use of the providers, the folks coming in the home, all that is covered. And so for patients who have Medicare, certainly, and for those that have other insurances, for the most part, all of those services are covered. For a nonprofit hospice such as ours, a community hospice, if individuals don't have insurance or don't have a hospice benefit, nonprofit hospices typically find ways to use their fundraising to cover individuals that don't have a way to pay.
Well, guess what, Doctor? It's time for the news. So we have to break into this discussion. So you're listening to Health Matters with the Medicine Center Pharmacy. You're listening to Health Matters with the Medicine Center Pharmacy. Today we are speaking with Dr. McFadden from Community Hospice. We have a lot more to cover this morning, so let's get back to the show.
So, Doctor, up to this point, we've talked about what hospice and what palliative care is. And I'm wondering also, based on insurance coverage or Medicare coverage, what services does hospice provide for family members who are also navigating this experience with their patient and loved one?
One of the benefits of hospice is that for family members, is that they receive bereavement services pre-bereavement while the individual is still alive, counseling and visitation with bereavement staff. But for the year afterwards, for 13 months after a loved one passes, they still have access to individual counseling and group counseling, group sessions. So that lasts for 13 months afterwards. And so the specialized bereavement services are the most significant. But hospice also, through the nurses, the chaplain, the social worker, we recognize in hospice that while the individual on hospice is our primary patient, with the hospice philosophy, their whole sphere of influence are our patient. And so we recognize that the way that an individual dies lives on in those who survive. And so we want to make sure that the whole sphere is well cared for in an effort to reduce pain and suffering. And so our staff provide education to them. They regularly try and meet with them to understand their goals of care. And so those would be additional pieces that they would receive in addition to the bereavement services during their hospice care and after the patient passes.
So I'm thinking about, if I'm a patient and I've elected to go into hospice care, or maybe I'm a family member of someone who is electing to go into hospice care, what can we expect up front? I'm thinking of you've mentioned a team of people that work together, and it sounds like there's a lot of moving parts, and it sounds like it could be somewhat overwhelming.
Yeah. So I think that you can expect that you will have individuals who are working specifically with you. And so while it may seem like there's a lot of moving parts, typically those individuals become a part of the family. I mean, they're folks typically are expecting their visit, are looking forward to it. And if they find that the visits are, too much or they need less, those visits can be combined so that, two folks are together, or three providers are together on the same visit. Or we can, say, okay, we're not going to have, this month, let's not have the social work come out to visit, or maybe just a phone call is enough to meet some of those needs. So definitely it's an effort to try and meet what the family and the patient needs, so it's not overwhelming. But I would say again, because so many people walk away at the end of life, many patients welcome having folks that are walking towards them or are coming to them. The other things that people can expect are questions regularly about what are your goals, what are your symptoms, are we meeting those needs, being checked in. So when I think about what people expect, those are hard questions that we're not usually asked. It's difficult for us to answer often. What are my goals for the care that I'm receiving? But that's a really important question for us.
Interesting.
So how about how do I help my family? If I'm the patient and I'm in hospice care now, how can I help my family cope with that once I'm signed up and in this program?
I think one of the things that families usually ask when their loved one can't answer the questions because of how the disease has progressed, they want to know, is my family member comfortable? They want to know, is this the right decision that I've made? And so I think that important things, while we're still able to speak with our family, to have community with our family, I think it would be good to talk to them about your choices and why you chose this, and why you feel like, if you're able to, why you feel like this is a good idea, what this means to you. I think that it's also important to have, really those really important conversations with family as early as you can. That's one of the reasons that having hospice early is so important, because as the disease progresses and anyone can see that this person needs hospice, at that point, they usually can't speak. At that point, they usually are in a semi-comatose state, or the medications that are needed to control pain or suffering keep them from being able to think straight. And so earlier in hospice, individuals can start having those conversations with family about, any reconciliation that's needed, any family history that they want to pass on, hopes and dreams for their family members, making videos, writing letters. Those are all important things. And so I think that those are things that individuals can do that can help their family who will be here after feel like this was the right thing for my family member, and I feel good about how they've lived and passed.
I had a story relayed to me once that I didn't really, in my pharmacy career, we've had some education on hospice, and we've had the luxury at one of the compounding seminars I was at, we had a hospice nurse from England speak to us, and she was brilliant. And she would tell us about how hospice care would help a patient and their family through what they're going through. And one of the things that really stuck with me was how her story was about a young mother that had, I believe, breast cancer at the time. And, so they went through a program with her where the mother was able to write a letter for her daughter at high school graduation and at college graduation, and when she got married. So she had all these things for the future. And it was like one of those things that just really, until you sit down and I guess think about it, and being in that position, it's really humbling to think about planning out that far, but how nice it must have felt on some level for her to be able to share those hopes and dreams with her child when she couldn't be there. So
Absolutely. Yeah, and that's something that we really try to do.
So, looking at your website, it was very well done, is very well done. And one of the things I thought was interesting was the Pet Peace of Mind program.
Yeah.
Can you talk about that program and how it's unique to your community hospice programs?
Certainly. Yeah. So, we have our pets and they're part of the family. And, as we're passing, we worry about the welfare of our family. And as a result, we worry about the welfare of our pets. And so Pet Peace of Mind allows patients, folks that are on hospice, to have a little bit of peace about what's happening with their pets. So we have volunteers that can go and walk dogs, can take pets to veterinary visits that they need, since the owners may not be able to do that, can take them to grooming visits. And if the family that survives are not able to take care of the pet, those services also work to find a new home for that pet. So to try and give that comfort to our patients, that their family member, their pet, who's provided so much comfort to them, will be well taken care of afterwards. We see that as being part of, again, being concerned about the whole sphere of their world.
So how about COVID? How's that affected hospice services?
I think that, like all healthcare workers, people that touch any aspect of health, COVID has been really hard on hospice, in the sense that we are seeing deaths at a rate that we're not typically seeing them. And our numbers, during the height of the surges, our numbers shoot way up, which increases our workload and increases stress as you're dealing with people that are rapidly dying, over and over again. And so that increases stress and increases the ability to provide self-care, to ourselves. But it also affects families and patients, because with COVID and the need to protect, others around, there's been the distancing that has not always allowed families to grieve in the hospitals as in the way that they've wanted, or at the bedside, or in the nursing homes. And so for many families, grief has been really unexpectedly hard, because of not being able to say goodbye in some situations. And so that has affected hospice. We also have seen many of our patients that reside in nursing homes who have other diseases were on hospice because of Alzheimer's, or because of cancer, or because of heart disease. And we knew that they were passing, but we thought that they were going to pass in 2 months. COVID comes through and they pass in 2 weeks. And so in hospice, we've been saying goodbye sooner than we were prepared to say goodbye. So I would say that it's affecting patients and their families because they're not able to grieve in the way, or have, death occurring in unexpected ways. It's affecting staff because we're just not able to keep up with, what's going on.
Wow. How about we take our final break here, Doctor? You're listening to Health Matters with the Medicine Center Pharmacy. Welcome back to Health Matters with the Medicine Center Pharmacy. We are talking with Dr. McFadden about hospice today. So, Doctor, what differentiates a not-for-profit hospice?
I think that some of the things that differentiate a not-for-profit hospice is that oftentimes those are community efforts. Often not-for-profit hospices spring up from a need within a community. You mentioned back in the 80s, that's when many started, and many in Ohio were county hospices, because members in the county said, we need to have a way to address this, this population and provide this specialized care. So not-for-profit hospices are often community-based. They usually have community members on their board, so they understand and are very aware of the communities that they serve. They do a lot of fundraising, which also helps them to understand their community well, but there's a buy-in from the community. So in many ways, the community feels a part of those not-for-profit hospices. And then the last we touched on earlier is that not-for-profit hospices usually find ways to give, covered care for individuals that don't have insurance or don't have a hospice coverage, so that those families, those individuals don't have to pay. They have fundraisers and others to cover those.
Interesting. So just as there are many different pharmacies, and I know there's different hospice providers, what should a patient or a family look for in considering a hospice operation?
I think you want a hospice that has a proven record, a hospice that patients and families speak well of, that has a good reputation in the community. I think you want one that's well staffed, just because when you have an emergency in the middle of the night, you want someone that's going to be there. You don't necessarily want to have to wait hours on end to have somebody arrive. In an ideal world, the physicians and the nurse practitioners that are providing the medical leadership for the team would be individuals that were known in the community and respected. Because I think that while it's a team approach, those physicians, those nurse practitioners can set the tone for how the hospice is going to be. I think that for reasons that we've talked about earlier, I think hospices that have an inpatient unit can add just a little bit of a different and potentially more to their patients. And so I think having an inpatient unit is something that is a distinctive that I would look for. I also, because of some of the other things that we mentioned earlier, I have a little bit of bias towards a nonprofit because they're in the community, they're driven by the community need. And so for those reasons, I think that the nonprofit is something that I would.
Okay, so what about bereavement services and support from hospice for the family?
Bereavement is such an important, right? Bereavement is such an important part of hospice and what we do. So the services that bereavement provides, there are individual counseling, one-on-one with a counselor, a bereavement counselor. There are group counseling sessions. There are resources and education for families up to 13 months afterwards, as well as the counseling and the group counseling. And then at community hospice, we have a specialized youth program, just because children and young adults grieve in a unique way, because oftentimes they've lost their caregiver, they've lost their parent, grandparent. And so we have a program called You're Not Alone. And that's a unique program that we have. And those bereavement services can start before the patient dies, and they go up until 13 months after they pass.
Doctor, I've read that many patients often delay receiving hospice care. And, there may be many reasons, from not wanting to acknowledge the need to a surprising concern that some may believe hospice care hastens death. Can you just briefly touch on the benefits of receiving hospice care early and how you would address the concerns that it might hasten death from a person?
So I think that receiving hospice services early allows for some of those important conversations to take place. It allows for symptoms to be managed earlier, which improves the quality of life at the end. And so oftentimes individuals find that they're not suffering, at the end of life. Oftentimes we'll suffer and suffer and suffer with pain, or other symptoms. And then we'll say, okay, finally, it's time for hospice. Earlier, we could have had those symptoms managed. And then as far as hospice shortening life, I think oftentimes that is related more to the sense that patients are coming into hospice late. So if you have somebody that, is late in their disease, anyone can see that they need hospice and they have just a week to live. You put them on hospice and then they die. We have this perception that hospice brought about their death because they came on and they died. If we have people on hospice earlier, we get that, we get to see that, patients really can do well with hospice. For those reasons, I think having them on earlier, get the symptoms managed, improve the quality of life, have those conversations, it's really important.
Doctor, can you share your contact info or your website address with the listeners?
Absolutely. Our hospice, community hospice, the website is myhospice, myhospice.org, myhospice.org. Telephone number locally is 330-343-7605. And an 800 number would be 1-800-947-7284.
Okay. We're out of time, Doctor. Unfortunately, we can talk about this much more for sure, but unfortunately, we're out of time. I want to thank you very much for coming on our show, Dr. DJ McFadden, MD, MPH with Community Hospice. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. And thanks to our sponsors, Cleveland Clinic Mercy Hospital, Studio Arts and Glass, and of course, our technical producer, JD DeAngelos. As always, we thank you listeners for joining us on Health Matters with the Medicine Center Pharmacy. Have a healthy weekend. We'll see you right here next Friday on News Talk 1480 WHBC.